you are able to protect yourself and protect your families in accordance with the information that you have. And the information you have is that you should be concentrating on saving yourself. Save yourself. And as I've often said, you save me, I save you. I save you, you save me. As for today's updates, let me very quickly just read the highlights, the details of this document are going to be with you so that you can pass it on in detail. But we tested some 8,679 samples in the last 24 hours. Out of that sample size, 723 people have tested positive, which means that the number of positive cases cumulatively in Kenya have now gone over the 300,000 mark to 303,959. From the cases reported here, 700 are Kenyans, while 23 are foreigners. 450 are male, while 273 are female. Again, looking at the age, the range in age, 9 months, 9-month-old baby. While the oldest is 87 years old. Over the same period, I'm very, very sad to say, we have also lost 16 patients, bringing the fatality to 341. On a more positive note, 44 patients have recovered from the disease. And from these 44, 24 are from home-based care programs, while 20 are being discharged from various hospitals, bringing the total number of recoveries to 8,165. My sincere condolences go to the families and friends of those who have lost their loved ones, and we pray that may God give them strength to go through this very trying period. And even as we continue with our holiday today, let's remember to keep them in our prayers and keep our country in your prayers. Kwa hivyo sitaki kuongeza mengi mimi hapo, kwa sababu mmeasikia. Vile tu ningeongeza ni kusema ya kwamba leo hii ni sikukuu, na tuwatakia Waislamu wenzetu heri Eid Mubarak, na waendelee kusherehekea. Hii nchi yetu ni nzuri sana, nchi isiyo ya kawaida, kwa sababu nchi nyingine kukiwa na sikukuu ya Waislamu inakuwa sikukuu ya Waislamu peke yao. Kukiwa na sikukuu ya Wakristo inakuwa ni sikukuu ya Wakristo peke yao. Nchi yetu ni ya maana sana na tofauti sana, kwa sababu hata sisi Wakristo tunasherehekea hii siku kubwa sana katika kalenda ya Waislamu, na vile vile Waislamu wanasherehekea siku ile kubwa ya Wakristo. Nchi yetu ya Kenya ni nzuri na tunajivunia kuwa wa Kenya. Vile vile mambo ya virusi kama nimevyotangaza inaendelea kuenea kila pahali, na sana sana tukiangalia upande wa Mombasa tunaona ndio tu area ambazo Mombasa, Kilifi ni area ambao tumeona kwamba virusi imeanza kwenda chini kidogo. Na sisi tungesema na kuambia watu wa Mombasa, sana sana upande wa Old Town Old Town Mombasa, kwa sababu hii virusi imeanza kwenda chini kidogo, kavi imeanza kwenda chini kidogo. Sio ati watu hawana virusi, lakini wale wanapata si kawaida kama hapo zamani, kama hapo mbeleni. Walikuwa watu wengi sana wanapata virusi, lakini sasa kwa leo hii kwa mfano watu 48 ndio wamepata. Na tungewasihi wale watu ambao wako area ya Mvita, mkifuata zile kanuni ambazo zimewekwa na masharti ambayo serikali imetoa, watu wa Mvita, nyinyi ndio wengi sana Mombasa wale wanaendelea kupata virusi. Kama sasa watu 23 kutoka Mvita ndio wameumbukizwa. Lakini kwa hivyo ni kusema Mvita ikianza, virusi ikianza kwenda chini Mvita, Mombasa nzima itaanza kuwa nzuri kuliko hapo mbeleni. Kwa hivyo ni kuwasihi tu kila mwananchi ashunge yule mwingine, ndio tusije tukawa na shida hizi sana. Ukiangalia vile vile tumepoteza watu 16, na hawa watu wasije wakasema ati mtu ambaye sio mzee sana hawezi kufa. Ukiangalia katika miaka ile ya wale watu wamekufa, unaona kutoka Kenyatta National Hospital kuna mama moja, one lady amekufa akiwa na miaka 22, a young person 22 years old. Vile vile katika Kiambu level 5 hospital kuna mtu mmoja pia, mama moja pia amekufa akiwa na miaka 37. Na ukiangalia hiyo listi ya hao watu, kuna vile vile Kiambu level 5 hospital jamaa moja, Mkenya moja ambaye alikuwa na miaka 28. Kiambu level 5 hospital, hiyo hospitali hiyo kuna jamaa mwingine alikuwa na miaka 24. Nasoma hizi numbers ndio watu waweze kuelewa na wajue ya kwamba hii virusi katika nchi yetu ya Kenya haishagui. Hata watu wachanga sana wanaendelea kuuawa na hii virusi. Kwa hivyo jameni, ni kuwaomba tu na kuwasihi, usije ukafikiria ati kwa sababu wewe ni miaka 20 na kitu ati huwezi kuumbukizwa ama huwezi kufa ukiumbukizwa. Unaweza, na inafanyika na inaendelea kufanyika. Hata sana kuogopa sana ni kwamba hao watu, unasikia watu wa miaka 28, utauliza kama walikuwa na high blood pressure, walikuwa na diabetes, alikuwa hana. Yule wa 25 years, 28 years hakuna chochote, alikuwa hana, no underlying circumstances. Ukiangalia yule wa vile vile yule wa 22, huyo alikuwa na high blood pressure. Lakini sana usije ukafikiria ati mtu huwezi kwenda na hii virusi kwa sababu miaka yako haijafika. Hakuna miaka ya kufikishwa ndio mtu aambukizwe ama aende safari ya kufa. Kwa hivyo ningetaka kusimamia hapo. Before we take questions, I wanted to invite Dr. Koki Mutua to just explain a little bit about the app, and then Dr. Amoth and I can take the questions. There you are. Wait. You want to spray? I know you are not very familiar with Dr. Koki Mutua. Dr. Koki Mutua is the Director for Public Health. And don't confuse Director for Public Health. And then you ask, what is Kuria? Kuria is head of the Directorate of Public Health. Please proceed, Dr.
For the air travelers specifically, with effect tomorrow, they will be provided with a link from their airlines and also from the booking agents. With that link, once they click the link, it will bring a surveillance form. In that surveillance form, they will be able to fill the details as shown in the surveillance form, and then they will submit. Once they submit, they will be given a QR code, which they can save, or it will be in a PDF form. Then they will proceed to the health desk. Once they get to the health desk, the healthcare provider will screen, and they will fill the details, like if it's a temperature, they will fill the temperature form in the surveillance form, and then they will release them if they are to be released. From there, the person will be prompted to give the daily readings for the temperatures for 14 days, still in the app. And then if you don't give the temperature readings, you will be traced by the contact tracing team. So we are expecting that the travelers will comply, and it will be easy for them. They're supposed to be filling this form at least before travel. So when you're booking your air ticket, you also pick this form and fill and submit, so that when you get to the destination country, like if it's Kenya, you already have all your details online. So I think that is it. Okay.
Asante. Maybe you can now take questions, a few questions.
Thank you so much, CS. Satolale NTV. This morning we saw a huge number of Chinese nationals leaving the country. This is, first of all, before the official reopening of the airspace in terms of international travel. Second, why so? What do they know that maybe we don't know? Are they scared maybe of an eventuality? I'm just speculating, but also a concern for Kenyans. That is number one. Number two, it's about leaders disregarding the social distancing rule. Waziri, we've had funerals where a local chief come and chase away people who are mourning just because there are like 20 people, but we've seen politicians going to funerals and there are huge crowds. Why is there double standards in terms of this? Thank you.
My name is Chemutai going from Citizen TV, and possibly maybe you can tell us whether you have given guidance to the Bukusu and Tachoni communities regarding protocol for the cut, noting that the events have seemingly begun starting yesterday and today. And then second, you may have touched on it a little bit, but in the last 2 days there have been 30 deaths. COVID-related deaths. Just possibly what is pushing these high numbers, and especially even just among the young people?
Waziri, shikamoo mgwana.
Marhaba.
Haya, naitwa Boni, nafanyia Weru TV kazi. Swali langu boga kabisa. Ningependa kujua andi saizi wizara imetumia pesa ngapi kupikana na hili janga la corona? Asante.
I'm Brian Otieno from KTN News. Yeah, there seems to be a sudden drop in the number of recoveries, especially from last week. Is there an explanation to this?
Nancy Okware, KBC. Swali langu ni kuhusu wale wagonjwa ambao wanapokea matibabu kutoka pale nyumbani. Tumekuwa tukipokea malalamishi kutoka kwa baadhi kwamba walipopimwa na kupatikana kuwa na virusi vya corona waliambiwa wajitenge. Lakini wakiwa pale nyumbani hakuna wahudumu wote ambao wamezungumza nao kufahamu hali yao. Na hivyo basi wanahisi kwamba wametelekezwa. Je, wizara inasema nini kuhusu madai hayo? Na vile vile hivi majuzi mlisema kwamba mtahakikisha ya kwamba familia zinafunzwa kuhusu jinsi ya kuwatunza wagonjwa wasio na zile dalili. Je, kufikia sasa mmefikia wapi katika mfumo huo? Asante.
Asante.
George Kibaso from People Daily. This is a little bit different from the update. It's on immunization. We've seen since COVID, we've not had anything to do with immunization. UNICEF has said that about 20 million children across the world are dying. So in Kenya, what are the preparations for this, or what is being done, and what does this portend for Kenyan children?
Thank you. Okay, asante sana. Seth, let me start with you about the Chinese and whether we are concerned or not. The first thing is that we are not concerned about people traveling. The reason being, Seth, that we have also got plane loads of Kenyans who have, for example, left the UK, left the US, and come back home. So there are very many Chinese in Kenya, and I'm sure that they probably had an arrangement where they were going to be evacuated. And as far as these protocols are concerned, the fact that you have been told that and we have said that we are opening the airspace, perhaps they had already organized something, because you never know. We could say we are opening, we have a disaster, and then we don't open. So I believe that like you, if you said that they might know something that you don't. Well, if you don't, I don't either, because we are exactly in the same boat. I presume that they don't. There is nothing they know that you and I don't know. I think it is generally just in their normal way of traveling and maybe just evacuating those they might want to evacuate. They are free to do so. We are also doing the same with our people elsewhere. As for the funerals and what you spoke about the chief, you know, when the president spoke 2 days ago, and we have also followed up with the same, we have insisted that burial protocols are observed. I attended a burial, for example, yesterday, and I can tell you that they were observing the distances that are required and what have you. And if there are 20 people attending a funeral, or between 15, 20 people, and they are all social distancing, there would be absolutely no reason, you know, to go and disturb them or to go and stop them. And in fact, that is the worst times that you can possibly, you know, engage people in something or subject people to something like that. So I don't know which particular area that was, but I just want to say, and it is good that, Seth, you have asked that question, because it gives me the opportunity to say, we are all very concerned and we all sympathize with people when they have passed away. We know that a lot of people, like in our African culture, we want to go and say kwaheri to a loved one. We want to go and give sympathy. We may not even know the person who died, but we know the brother, we know the sister, or a relative, and we want to go and keep them company as they mourn. But I just want to ask Kenyans that we begin to appreciate that this is no longer possible. So when a loved one dies, I mean, for example, when I went to the funeral of the Secretary General of the PCA Church, I would like to imagine there would have been thousands of people in that funeral. And there was just a handful, because this is the new protocol. So what I'm saying is that even when we lose loved ones, very painfully, we have to accept that we cannot all go and mourn our friends or our loved ones. Today, there is the burial of the son of a very close friend of mine at a personal level. And I'm not attending because it's the new normal, it's the new protocol. If I go there, I'll just be adding to be part of the bigger crowd that we are trying to stop from gathering. So I want to say very humbly, with a lot of humility, please, there is no reason to subject oneself at a time of grief and tears, to subject oneself to humiliation by chiefs, sub-chiefs, or police in executing a responsibility that they have to, because of the nature of the results of a gathering. So we would please plead with Kenyans that we mourn in a manner, in a new normal, within the confines of what we have to do in this new way. Secondly, even not just the funerals, even weddings, the same thing applies. Please, when you have got a wedding, it is very, very important that you contain a wedding to a very small number, the 15 that we have been talking about, so that you are able to keep your social distancing. And again, I appreciate completely. I appreciate that as Africans, we like to attend weddings. In fact, there are people who go around on Saturdays just looking for a wedding to attend. You know, you don't have to know the people. But there is a new normal. Now, we need to know, we have to contain it and be just a few people who are attending the wedding. Hapana sio mchezo, sasa tunajua hiyo ni kweli. Kuna watu wanatembea Saturday. Wanatafuta ni wapi hiyo harusi iko. Shemtai, on the guidelines, yesterday I spoke about this issue regarding the cut or circumcision, so to speak. And we have said that circumcision can only happen along very strict guidelines discussed and executed with the officers of the Ministry of Health. So those who might go carrying out circumcision with all sorts of gadgets and killing our children will be held completely and totally responsible. Because we have already said that this is not something that you should go doing. This virus is very, very easy to spread. Can you imagine if you had a circumciser who is positive himself and goes cutting away 100 kids? Can you imagine the impact of something like that? So I think for those who are sane, because there are guys who are just insane. For those who are sane, please stop your children from being taken to somebody who just goes under the name of guys as a circumciser, who has not been tested, who we don't know, who doesn't know the status of. We don't know under what kind of health circumstances they are operating. So it's important. It's important. We appreciate. This is a very important ceremony. We know that. Some of us have gone through it. But it is not to say that we go killing people in order for us to maintain some sense of ceremonial importance. It's good. It's important. But it is not enough reason to die for. 30 deaths, Chemtai, yes, you are right. There are 30 people who have died. This is a matter, of course, of serious concern. And you have seen there are younger people, which informs why we have been talking about the whole issue of gathering, the whole issue of socializing. And that's why we have said the fact that we have stopped alcohol being taken in bars is to stop you from socializing. It is not to shift the socializing into turning your house into a karumaindo or to a shabin that people go and drink alcohol in. If you turn your house into a karumaindo and you bring people there, then what's the difference between us? No, it's very serious. It's very serious. There are those people, we are aware that there are people who have started thinking that the way to cheat the system is to turn your house into a shabin. But can you also cheat the virus? You know, are you capable of also, you have escaped from the police. How do you escape from the virus? Wewe unaona wewe ni mwerevu sana. Ni mwerevu sana kwa sababu baa imefungwa, muingie pahali pengine, muanze kunywa huko. Lakini sasa hata ukibia kwa baa, sasa hata ni virusi una invite kwako nyumbani. You are inviting the virus in your house under the guise of happiness and merrymaking. Bonnie, I cannot tell you right now, standing here where I am, how much money we have spent so far. But if you put your question, the ministry, we have no problem at all detailing how much we have spent. But if you ask me right now, I don't know. I don't have the figure in my head. The recovery numbers, Brian, it is indeed what you said. There's a drop in the recoveries, but I'll explain this. First, when we started the protocol of home care, we had a huge surge of people when we were following the WHO protocols of releasing people after 14 days, even if they were positive, because at that time, they were able to go home without necessarily infecting others. So we had a huge number of those people who were in hospitals at that time. So that explained why there was a surge upwards of people we were sending home. And of course, that has now sort of stabilized. Now, that's one. The second one has to do with perhaps, and I'm going to ask Dr. Amoth in answering the other questions to also speak to this, perhaps it has also got something to do with the weather, because we are also in the second phase of the flu, the second phase of our flu months, and that perhaps might also influence how quickly people are recovering as opposed to in the warm weathers. But I am not an expert in that one, so I'm going to yield the question to somebody a lot more wiser in those circumstances. And I'm also going to ask Amos to respond to the issue of immunization. The issue of community health workers, yes, we are continuing with the training, and I think that we can also expand a little bit more. Immunization, community training, and the recoveries, Dr. Amoth will speak to, particularly in view of what, George, you have just said about the 20 million children worldwide in accordance with the UNICEF reports. So let me hand it over first to Dr. Amoth, and then I can wrap up. Please.
Thanks, Waziri. I'll start with a question from George on immunization. Vaccines are one of the most potent tools in public health, and year in, year out, more and more children are getting vaccinated. However, with the pandemic comes a different set of challenges, which definitely affect the delivery of healthcare services, especially sensitive healthcare services like vaccines and immunization. And this is brought about by a variety of reasons. One of them, of course, is the economic hardship that entails because of the containment measures that have been put in place. Number two, of course, is a restriction of movement and gatherings, so we cannot be able to do what we call outreaches, where we'll be able to bring mothers together with children to be able to carry out a vaccination campaign. Number three, of course, is fear of contracting the disease from a healthcare facility. And probably number four is repurposing of the healthcare workers to be able to provide services for the ongoing COVID-19 pandemic. So there's a shift in movement of the healthcare workers from critical areas to be able to support the ongoing pandemic. And this is not a unique situation, because same thing happened during the Ebola outbreak in 2014 in West Africa. However, what we have, WHO and UNICEF have also picked this up, and as a ministry, we have developed a protocol now to ensure that essential healthcare services, including vaccines, HIV services, TB services, malaria, continue during this pandemic. And we have shared this platform, this information with the counties to ensure that children who require to receive vaccines and anybody else who requires to receive any particular service, the services are available. Further, we have gone ahead to be able to train healthcare workers to ensure that they are safe when they are delivering services and they don't pose a risk to the clients they serve when they are delivering services. This includes provision of personal protective equipment to ensure that infection prevention and, of course, enhanced infection prevention control measures to ensure safety when we deliver services. So it is not entirely correct to say that vaccination or immunization program has come to a standstill. No. The services continue, but they have been adversely affected by the factors that I have highlighted. And what we are trying to do is to ensure that these services continue. For vaccination, of course, there could be a chance that we could be able to do what we call a catch-up vaccination. But look at a pregnant mother who misses to go for the clinic because her pregnancy has a definite time frame. If you lose that, then that is a life lost for good. So we are working very hard as a ministry, the county government, development partners, including WHO, UNICEF, to ensure that we do catch up immunization activities to protect the lives of our children. It is not right to replace one pandemic with another. So COVID should not be able to replace vaccine-preventable diseases like measles, polio, and will ensure that we work along with all partners to protect the lives of Kenyan children. For the home-based care services, yes, we are ramping this and we are continuing to train the community health volunteers on an electronic module, and we hope that this training will be over by mid-September. It is not entirely correct to say that those who have gone on home-based care have been abandoned, because we have community health volunteers spread out throughout the country. But some counties are performing at different levels. There are counties which have a very strong community health system. Those counties will definitely do better than those who have fewer community health units. And the support will continue to those who are under home-based care, including psychosocial support. The training of individual members of the households will follow once we are done with the training of the community health volunteers in September. There was a question in the drop-off recoveries, which Waziri has articulated very well. But also the other thing that we face is now, when we go for home-based care, is that the reports have to come from the individual household. So there is sometimes a delay in terms of reporting by the community health volunteers and also the the healthcare workers, because of community transmission, and therefore people are more and more engaged. But we'll always be able to catch up with the backlog. But more important is to look at the case fatality ratio for the country, which still stands at 1.6% compared to the global average of 4.5%. So at one point, even if we lag in terms of reporting, so long as these people are not dying at the community level, the numbers will equally, at the end, balance out. I think that is all that came my way. Thank you, Waziri.
Okay, thank you very much. As we were speaking, the PS for Transport joined us, and instead of him just having a nice visit, let me subject him to some questions that we might be asked about Piki, about matatus, and about other means of transport that he is also working on to perfect, to make sure that we do not have a spread. So if you can join us here for a minute, on a PS. Can very briefly say something about, I know I'm ambushing you, but it is good for you to do that. So that we don't just talk about international travel, which he has spoken to and which he can clarify anything he wishes to. But in terms of the other means of transport and modes of transport, lest we forget that they are also part of the system that we have developed for containment.
CS, just to clarify, first starting with the Chinese who came this morning, during this COVID period, we have actually been allowing essential services, and those people who are considered to be undertaking essential services. So this is something that had already been processed much earlier. It's only that it's coming very close to 1st of August. But it had been processed because many of them are involved in quite a number of construction companies, and they had made a request, and that had been accepted. So they were coming as part of the essential services, and it's only that is a bit close to 1st of August.
If I may interrupt for Seth. This is Seth 2. He was talking about travel out, I think, not travel in.
Okay. Yeah. Okay. This was travel in. It was arranged flight actually. Yeah, for evacuation. CS. The other thing is about the road transport, including even the borders. These were covered comprehensively by road travel protocol, which we have already commenced implementing when His Excellency the President opened those counties that were initially locked. And we actually met last week and reviewed implementation, and we are going to enhance the implementation of those protocols with regard to motorbikes, matatus, and the other vehicles. Thank you, sir.
Thank you. Asanteni sana. Have a nice day.
We did receive this machine way back in 2016, and since we got the machine, it's been very useful for me in particular because we are able to offer all the diagnostic ultrasound services.
I am a beneficiary of the ultrasound machine donated by Lotto to PCA Kikuyu Hospital.